Hi, everybody. Welcome to Scioto County Daily News' Town Hall on COVID-19. We're going to be talking to local health experts and me from Scioto County Daily News. I'm Sin Mackley, and I'll be joined by other local journalists to talk to the Scioto County Health Director and the Portsmouth City Health Director and the Scioto County EMA head. But first, before we get started, we want to give a shout out to our advertisers. Hello, welcome to Scioto County Daily News' Town Hall meeting on COVID-19. And I'm here today with Dr. David Byers from Portsmouth City Health Department, Dr. Michael Martin from the Scioto County Health Department, and Larry Mullins from Scioto EMA, along with several local journalists. I'm sorry, my computer just went. Chip Millay from WIOI, Bill Shope from the Scioto Voice, and Sam McKibben from WNXT. I'd like to welcome everybody, and how this is going to work is we're going to start, and we're going to switch, but we're going to open up, and we're going to have our health directors address you and talk about what we're doing here, and then we're going to go back and forth, and each of the reporters are going to be able to ask one question at a time. We have a long list of questions we're going to try to get through. We probably won't make it through all of them, but we're going to give it our best shot to answer your questions about COVID-19 and let you know what you need to know to stay safe. And I'd like to start off by asking, let's start with Dr. Martin. Dr. Martin and Dr. Byers are both going to make some opening statements to tell you a little bit about themselves. Who wants to go first?
I'll go first.
You go.
Dr. Michael Martin, Scioto County Health Commissioner as well as Medical Director. I'm board certified in internal medicine. I've been practicing medicine in Scioto County for the last 26 years. The Scioto County Health Department is a small health department. We've got 3 full-time nurses and 1 part-time nurse. And the full-time nurses are spending most of their time doing isolation and contact tracing, as well as issuing orders for isolation and quarantine. And this has taken a large amount of their time. They're working overtime. They worked till 10 o'clock last night. They've been working about every weekend since this thing began. So this is a real disease. It's causing real illness in Scioto County. It's spread fairly easily, and we need to take it seriously and do simple things like wear your mask, wash your hands, stay 6 feet away from each other, and I think we'll get through this. Thank you.
Dr. Byers.
Yeah, hi everybody. I'm Dave Byers, and I'm the medical director of the Portsmouth City Health Department, and I'm also the infectious disease physician at the Southern Ohio Medical Center. And so I've had the opportunity kind of to view this disease or work with this disease in both roles, both as on the public health side, where our city health department, much like the county, is spending a significant portion of their resources and time, managing folks that have been exposed to the disease, have the disease, et cetera. But also on the hospital side, where I've been involved in basically seeing all of the patients that have been admitted with this disease. And I can't reiterate enough what Dr. Martin said, that this is very much a real disease. There was a nice article by CNN last week that talked about now that as of this point of the year, COVID makes the third leading cause of death in America, right? And, people often compare this to influenza, but we're at 170,000 plus deaths related to COVID-19. And unlike deaths related to influenza, which are actually calculated and oftentimes have a significant amount of wiggle room, deaths related to COVID-19 are pretty much directly counted. And so probably underrepresented in that real number. The number is probably higher. And so if you take all the flu deaths counted over the last 4 or 5 years, it still doesn't get us to where we are now with COVID-19. But more importantly, because again, people often will say that this is a disease where, a small percentage of people die. That is more a marker of how much better we've gotten at treating it, even in the last 4 to 6 months. But the real thing to understand is that there have been a variety of studies now looking at the adverse consequences of those who get the disease that aren't even sick enough to be hospitalized in terms of long-term adverse events. There was some Italian data published a few weeks ago that said that about 80% of patients who had COVID-19 2 months after the disease had not returned to their baseline health status. And there was some German data from a couple of months ago that looked at basically 100 randomly selected patients who were post-recovery from COVID-19, and about 70% of them had an abnormal MRI or imaging of their heart from the effect that the COVID had on their heart, and about 60% of them had abnormal tests that suggested that the COVID was still creating inflammation in that heart muscle. So it's one of those things, like Dr. Martin said, where this is absolutely a serious disease, and the things that we can do to protect ourselves and each other is wear a mask, wash our hands, and try to stay some reasonable 6 feet distance apart.
Mr. Mullins, what would you like to tell us?
What Dr. Martin and Dr. Byers have said. I read an interesting statistic the other day that we've lost more people now to COVID than we have than those killed in World War I and Vietnam combined, which is quite a number. And you kind of look at it a different perspective. The Scioto County EMA's job is to work with our healthcare partners. We are working with the hospitals and, of course, the health departments, and trying to push out as much public information as we can to try to make sure that people have the latest information so they can make, educated, decisions on how to live their life. But we just would emphasize what the doctors have just said, and that is, if you're out in public, please wear a mask, wash your hands, and do everything you can to slow the spread.
I'm going to start off with the first question, and this comes from, we put out to readers, give us your questions, and we received hundreds, maybe close to 1,000. And what really struck me was the number of people who just flat out don't believe what you're telling them. They don't believe the numbers. They don't believe the test results. They are just not buying it. They think it's a scam. Does this surprise you? I mean, what do you think this is? And what do you think can be done to counter it? Just hop in.
Yeah, well, there are a lot of people who don't believe that, you landed on the moon. There's some people who believe in the flat earth, but, David's seeing it. I'm seeing it. If you look at, just go on the news and look at what happened to New York City and some of these other large cities, they're seeing this, and it's all over the world. So I know it's invisible. I know that you can't touch this virus, but there are people out there suffering from this disease. So to flat out say that it doesn't exist, that it's some giant conspiracy, is just flat out wrong.
Anyone else there?
Well, I just want to reiterate that. I mean, it's one of those things that, in the hospital, we had, more than 10 people hospitalized at a point this past week with the disease, and some of which were very, very ill. And while, yes, a lot of respiratory viruses can cause people to get very, very ill, the bottom line is the numbers on this are what's actually so staggering. And so, traditionally for influenza, which is what is often, compared to this, we have a small minority of patients in all age groups that end up hospital sick, usually well under 10%, and mortalities, even in the highest group of people that are, over the age of 65, have other medical conditions, death rates, 1, 2, 3%. Whereas with this disease, unfortunately, in all comers, the death rates are multiples of that, especially in folks that are kind of over the age of 65 or have other chronic medical conditions. And it's one of those things that we are seeing it firsthand from a public health, but also at a patient care level, and it is having a real impact on people's lives.
Anything to say, Mr. Mullins?
Well, I think too, you don't have to look very far. Just down the river, 25 miles down in Vanceburg, they've lost 4 people in a county that I think is about 15,000 people. And we've unfortunately lost a person here inside the county. But all around us, there's been deaths. And this is a kind of disease that, a young person can go out and go to the beach and have fun and then bring back and really do some damage to an elderly grandparent or somebody who is, their immune system is compromised. So you don't have to look very far to see how serious this is and that it is a deadly disease.
Does anybody have any idea of what more can be done? Because all of these numbers have been given people for months. Of any idea of something different that could be done to change just the minds of, and it's surprising. It's not people who don't believe the earth is round. It is people who are normally pretty sane, I guess, or, pretty up to date. And any ideas on what could be done to change their mind? Anything other than additionally what anyone said? Or is it just a puzzle?
I think until it hits home, it won't be real to some people. Until they lose somebody, a loved one, or know somebody who lost a loved one, it will not be real to some people.
All right. Nothing. We'll go on. Chip, you can go on. Ask a question.
Good. Thank you for letting me and WIY Radio be a part of this town meeting. All right, let's talk masks. I'm in my 60s. I go to a lot of meetings, so I'm wearing a mask to the meeting setting because I'm told that by the doctors and by Larry and everybody else, we should be wearing a mask. Governor's telling us that to protect each other. So I go to the meeting. Most younger people are in there sitting around not wearing masks. They're all grouped together. And by younger, I mean 20 and 30-year-old people, professionals. So what should people do in a situation like that? And what are your thoughts of why this should not occur?
Well, you get to set the example, Chip, that, wearing a mask helps protect you, actually, and also helps protect them from getting any disease from you. When you think about this disease, when we talk, spit's coming out of our mouth, it's going in a way like 6 feet. So you get the disease by being close to somebody, you're really spitting in their mouth and in their eyes. Or whatever. So if we can, wear a mask and prevent that from happening, it's a small price to pay, I think. You and I are old enough to remember we used to drive around in cars without seat belts on, and now they're required. And they're required because they help protect, you from death. And so, it's one of those things that you're helping yourself out, and also you're helping your neighbors out by not, not getting this disease. To me, this is a patriotic thing to do. Actually, to wear your mask, you're working for America. You're not working for the Chinese Wuhan virus. Let's protect all the Americans around by wearing a mask. And we get to do that by example, as David and I do, wearing a mask wherever we can and outside.
If I can follow up real quick, how much of me is wearing a mask is protecting you versus helping me?
I'll let David take that one.
Okay, so actually it's a really good question, and it's one for which there is not a great straightforward answer, but for one that we have a better answer than we probably did a few months ago. And so much of the data we have on how effective masks are actually stems from where we've studied it the most, which is really around influenza, which is usually in most years our biggest respiratory virus problem. And what is very clear is that you and I wearing a mask is a civic duty, right? Wearing a mask is the new not smoking indoors or the new wearing a pants thing, right? It's the thing you have to do because it does protect other people. But beyond that, the WHO has a very nice summary on kind of the benefits of masks in all situations. And even in non-health related settings, it does appear that having a mask on protects you as well. It protects the person in the room with you probably more, but it don't sell it short in the sense that it does have some efficacy to protect you. How much it protects you has to do with the filtering efficacy of the mask you're wearing. And so that's where it kind of gets into the, yes, the protection for you is higher with, say, an N95 mask or a surgical mask than it is with a very thin piece of cloth. But that's all the more reason that whenever we talk about face coverings, what we really want to encourage people to do is, use masks that are not so thin that if you can blow a candle out with that mask still on, the answer is it's not doing anything for you or the folks in the room, right? And so cloth masks, they've done some studies that if they're actually appropriately thick, they are approaching the efficacy of a surgical mask. But the most important thing is that it does have some protection for you. The most benefit still remains the protection for the other people in the room, which is why we have to remind each other that we're all in this together and we've got to wear masks.
So we could really cut down on it if everyone wears their mask.
That is the bottom line.
Okay, well, good. Thank you. We're going to move on. And Mr. Shope, are you there? And do you have a question?
Yes, actually, I've got a two-part question. Thank you. First part is, please explain the differences and advantages of the two main types of COVID testing methods.
So I guess maybe I'll take that one. So the thing is that right now there are really three different broad testing methods. The one I think the 1 and 2 you're speaking of primarily are basically PCR, what we call looking for the virus's RNA, and that's usually done by a nasal swab. Though more recently you've seen that the Yale folks have studied this, even doing it in saliva, which we're anxiously awaiting some more information on. And then on the other side of that is the antibody test. In the middle is actually a thing called an antigen test, but we'll kind of skip over that because it doesn't have a lot of clinical utility. What we want to focus on really is the way to think about the testing that looks to tell you if you have the disease and testing that tells you that you probably had the disease. The much clearer benefit is in the testing that tells us you have the disease. And that's those nose swabs that you see being done, whereby we take those and we actually put them on a machine to look for the virus RNA. And so those tests are incredibly specific. So kind of a marker of statistics where if the test is positive, it's exceedingly unlikely that it is a false positive with that type of test. It's a mathematical possibility, but it's a rarity. With those tests, there are some false negatives, and that's one of the things we really struggle with, and which is one of the many reasons that a negative test doesn't say, oh, you don't have it, if you've been exposed, those kind of things, because the false negative rate is variable depending on where we are in the disease state. And so if you are early in the disease, you can have it, but we can do a nose swab and not necessarily have a positive test. Whereas later in the disease, 8-10 days in, it's more likely that we'll find that virus there, but it's not 100%. There are people that definitely have the disease that can have a negative test. That's a small number. The other part of the testing is looking for blood antibodies to say that the person has had the disease in the past. Those are interesting in that it can say the people that said, gosh, I had illness a couple weeks ago or a couple months ago and I didn't go get tested. Yes, you can get tested and see perhaps if those antibodies are positive. The issue with the antibodies, unlike the nose testing that is the molecular testing that looks for the virus itself, the antibody testing has a false positive rate that's a little bit higher. And so having a positive test isn't 100% certain that you have the test, but also a false negative rate. There has been a variety of studies shown that in people we can prove that had COVID that have antibodies that are negative. And so diagnostics in this disease are very challenging, but in broad terms, those are the kind of two big categories of testing we have, and both are available in this community.
Dr. Martin, did you have any further comment on that? Or?
And the positivity rate at SOMC, I think right now is the 30-day rolling average is 3.5% for the nasal swab, and it's around 2%, I think, for the IgG test. So,
well, as I'd said, it was a two-part question. If you could, what are more? Which of the two are more common, false negatives or false positives?
I think David explained it pretty well, and it's with the PCR, the nasal swab, right? It would be a false negative because you're also looking at sampling error and time and the disease and all that stuff. So.
Okay, and that was the second part. I just wanted clarification for it.
Okay.
All right. And then we'll move on. Mr. McKibben.
Thanks for the opportunity. I think we all appreciate being with you today. My question is, are protective face masks the best protection against exposure to the coronavirus? How about full face shields? I see them being worn. Are they as protective as the face masks for either doctor?
You're on, David.
Okay, I'm on. So the answer to that question is comparing one to the other, we don't have that answer. One in addition to the other, the answer is pretty clear. And so wearing a face mask remains the best protection you have at both prevention of transmission to others, but also you yourself getting the disease outside of just, again, distance. But when we talk about where you can't control that distance, again, like us in healthcare kind of thing, the mask is still the most important factor. And this has been looked at in a variety of different studies. There was also a nice study done earlier this year that was a meta-analysis that was funded by the WHO that suggested that the addition of eye protection does add more benefit. And this was also shown recently published in the JAMA looking at some Indian health workers. And so what they showed was that the addition of face protection or face shields, eye protection, covering your eyes, which are also mucous membranes, did decrease the rate of infection in that group. And so what we don't know, and what remains probably not in the short term with an answer, is if one is better than the other. I think we would think that the mask is better, especially for protection of others. What to think about a face shield or an eye protection is that it's addition to a mask, not a replacement of it.
All right. Thank you. Good answer.
Yep.
All right, I'm going to move on, and I've got a reader question here. And this is, if COVID-19 is so dangerous and contagious, then why are there no hazardous waste bins all over the state, county, and city to dispose of masks and gloves? And I'd say that I've seen that. I've seen masks just littered around parking lots and gloves thrown in grocery carts. So what would you say to that?
Well, the main transmission of this disease, we believe, is respiratory droplets. So you're looking at that 6 feet from when you talk and when that respiratory droplet lands. So we've kind of backed away a little bit from getting it from surfaces, although there could still be some transmission that way. So this is mainly spread through the respiratory droplets that you have within 6 feet of you talking.
You guys get there? All right, then we'll move on to Mr. Malliott.
Back to me.
Back to you, sir.
Okay. So let's just say if someone is feeling sick with COVID-19 symptoms, what should they do? And I'll just follow up with this second part of the question. If I have COVID and I feel like, really bad, and what would my treatment be, Dr. Martin, since you're my doctor?
Oh my gosh. Put me on the hot seat.
Well,
if you're sick, you can call your doctor or call the SOMC line 356-CARE, C-A-R-E. They can arrange for you to get tested for COVID if that's a big concern. Now, I just mentioned that we do a bunch of COVID tests here at SOMC, and 3.5% are positive. That means you have a large, you're not very likely to have COVID, right? And when we first did all this, so we did respiratory virus panels back in March, and I believe about 20% of people who had cold symptoms had something positive on that test, which was not COVID. So, the odds are, number one, if you got a runny nose and a cough and a fever, that it's not COVID. But you still may want to get tested because of other reasons or exposures or things like that. So you'd either call your primary care doctor, they could write you an order, or you call that 356-CARE hotline, and they can get you an order. Now, one of the things that happens if you are positive and you are sick, and my county health nurses call you and say you have COVID, you are now in isolation, we can help get you a thermometer, we can help get you a pulse ox, so we can monitor you at home. And if your symptoms worsen, then we would have you direct you to the emergency room and notify them that you have COVID, you're coming in, and you're getting sick. And that's so you don't expose everybody, the EMS and the ER, to COVID. So I hope that answers your question.
Well, and part of it is, I guess, what type of medicines are people taking that's available to help with the symptoms of it and to relieve pain or congestion or to help people sleep.
All right, well, we're back to the usual cold medications, and I don't know, I know your medical issues, but I don't want to broadcast that for everybody, but, take some, Mucinex and Tylenol and things like that just for like regular cold symptoms. But we don't really have much as outpatient treatment. I can mention a few things, but nothing's been approved. There is treatment if you're sick enough and you're in the hospital, and Dr. Byers has written those medications, but I have not. So it's really just symptomatic care until you get a lot sicker, and then you have to come to the hospital. We have to give you oxygen and all those other IV medications. So there's nothing, over the counter that you can take.
I can't not ask this question and piggyback off of his, but what about hydroxychloroquine? I know the feds sent us a bunch of it at the beginning of the pandemic. Is that being used? Is that commonly prescribed? Or
back to you, David.
I'll take that one. And actually, I think that the real theme in all of this is that the public is getting the opportunity to watch science in action, right? And this can be frustrating for folks because you see that what we believe is the best option is changing, and sometimes you want to just say, well, gosh, there's got to be something I can do. But as this is a novel virus, we're learning as we do this, and we know much more about how to take care of people with this disease now than we did back in March or April. And to the first question about treatment, the thing to remember is that all of the treatments that have been looked at so far have not made a significant difference in folks unless they were sick enough to be hospitalized and require oxygen. And so we all want to, when we're at home and we feel poorly, to have something to make us feel better. But short of the kind of symptomatic medications that Dr. Martin mentioned, like Tylenol, those kind of things, there's nothing that has been shown to be effective that you should take as an outpatient. And I want to specifically mention things like steroids, because people will ask us that, like, oh, I heard on the radio or the TV that the people got steroids in England and they did better. Well, what they didn't, what we're missing there is that in that trial, which did show mortality benefits for the use of steroids, it actually showed that in people that were not sick enough to require oxygen, those steroids had a trend towards harm. To the other question related to hydroxychloroquine, that's actually been one of the very interesting things of all this, right? We have learned more as we have gone forward. There was some initial studies or initial reports as this disease developed in kind of March and April that said that hydroxychloroquine may have a role. Follow-on studies have shown that it doesn't have a significant benefit in patients that have the disease, but it does have significant toxicities. And that is one of the reasons that all major professional societies, the Infectious Disease Society of America, the NIH treatment guidelines have removed hydroxychloroquine and are not recommending for its use, because it's not been shown to have significant improvement in outcomes, but it does have significant adverse effects. And so personally, the best thing I can tell you is, and I would like to think that I probably know as much about the treatment of this disease as anybody, if I got sick with COVID, I would not take hydroxychloroquine. And if I was an outpatient, if I wasn't sick enough to need to go to the hospital, short of taking symptom medications, there aren't things that are likely to make me feel better.
Okay, thank you. I'm going to move on there, and I'm going to ask a question from a reader. And there's a lot of suspicion is, what is the procedure for listing COVID-19 as the cause of death on a death certificate? We have several readers say things like, if someone dies in a car wreck, they list them as having COVID-19. Could you spell that or explain the process?
Yeah, I'll explain. It's not true. There's no one going to go out there and swab somebody and show that they have COVID after a car accident. When people get admitted to the hospital for a long period of time, let's say they went in there with COVID, they got over their COVID, but they were still in the hospital and they died from a complication in the hospital, like a blood clot or something like that, whether that same hospitalization, well, then COVID would be listed as a reason that they were hospitalized, right? But if you've had COVID and you've recovered, and a few weeks later you die, that will not be listed on your death certificate. I don't know of anyone right now. I've never heard of anyone that's running out there, putting COVID on death certificates for any reason. that's not medically necessary. We're required to put on the death certificates what we believe is the appropriate diagnosis, appropriate cause of death, and I think most doctors do that without. They do the right thing when it comes to that. So I don't think there's any, again, conspiracy about throwing COVID on.
What are some complications that COVID could throw out there that somebody could die of, and they might think, well, he didn't die of COVID, he didn't die of like coughing or something, like blood clots or other things. What could it throw out there that maybe you would die? This would be the thing that killed you, but.
Yeah, there's a lot of things we're learning about this disease, right, Dr. Byers? I mean, this is a disease that can affect a lot of organs. It's been shown to cause kidney failure, clotting, heart attacks, obviously pneumonia. There's some things about meningitis, encephalitis, and all these terrible things that can go on. So, any of those things, renal failure, liver failure, if you died from that and it was, caused by the COVID, we would say, oh, they died of liver failure, but it was caused by COVID. So that's how it would be listed.
All right, thank you. All right, Mr. Shope.
Yes, thank you to both of you. In your opinions, why was there so much misinformation about a child's ability to not only be infected but also transmit COVID early on in the pandemic? And bluntly, do you consider children to be able to be a serious transmission risk?
Well, you just jumped into a big controversy, and it is still ongoing. There was still some recent data that David can probably tell us a little bit about that. But we're in the middle of a battle, and we're learning about this as we go along. As David said, you're watching the sausage being made, and sometimes it's just not crystal clear what was a fact 2 months ago is not a fact today. So.
And I think that's really it. I think what Dr. Martin said there is really much the point is that whenever this all started, if we typically think about respiratory viruses, quite frankly, the children are generally the amplifiers in a community. And we've known that for years with a variety of respiratory illnesses, but most notably influenza and diseases related to the bacteria called Streptococcus pneumoniae, and we can track that. And so there was some initial thought that maybe kids don't play a bigger role in this because we didn't see a lot at the start of this. What we are now learning is that it was more a fact that we stopped that experiment short. And the experiment, of course, is that children going to school, right? So whenever they closed everything down in March, that basically took away the ability to run that experiment where you were having lots of kids in close contact, but also too, kids don't get as sick with this. And so I don't think out of malice or anybody trying to overlook it so much as, and whenever this really kind of came on and the testing was very limited, they went and the effort was spent on testing people that were very sick. Well, what we are learning now is we've done a lot more testing, especially related to exposures, where you tested a child that you didn't think, wasn't particularly symptomatic, but, they were exposed to somebody that was. We're seeing now that children represent a significant portion of positive folks in the community, and how much of a role they play in amplifying that or exposure to other people is still being learned. But what we do know from a couple recent studies is that the Koreans and a couple others have shown on their data that if you look at the nasal swabs, again, where we talked about, we look for the virus itself in the nose, that children, even young children, have high levels of the virus in their nose. And so there's no reason to believe they can't transmit it to adults, even though they aren't particularly getting so sick with it. But I think that has a lot to do with the fact we just weren't testing a lot of kids early, and they weren't all together now like they will be. And so I think we'll know a lot more probably in 6 months.
Well, given that, and given that schools started back up, how concerned are you that community transmissions are going to increase?
I think we're both concerned about that, especially in the schools. That's why the schools have taken some precautions. They're going to cohort kids, wearing masks like the governor's required, and same for the teachers. And they're going to try to minimize contact. So when we do have a contact or a kid with the disease, we're going to be able to isolate that child and also quarantine that cohort. And as you heard, the president also declared that the teachers are going to be essential workers, which I kind of agree with. we need education for the children. This is very important for them to get back to school, to socialize to a certain extent. And we need the teachers to lay eyes on these children, because we have a lot of children who are at risk for other things in Scioto County, including food insecurity and abuse. And we need teachers to put an eye on them. I don't know if you know that, but I think there's a decrease of 27% of child abuse reports once the schools were closed. So it's important that kids do go to school, and we are hoping we can do it safely and effectively.
Okay. I have a question from a reader who'd recently gotten tested, and she wanted to know why you don't have to show an ID to be tested. Said all they asked was for her name and address and phone, and that anybody could have said they were her.
I wouldn't know what the utility would be of going and getting tested and having things stuck in your nose just for fun, but we don't want to create any barriers to testing to people who need to get tested. Let's not create barriers to testing and treatment.
Well, I think there have been some reports of people getting called and said that they had test results who said they actually never made it through to the testing, that they signed up and went home. And again, maybe some of those are just phishing scams, but that means someone's, trying to con you and get your personal information, because there I was using terminology without explaining it. But some people seem to think they've actually been mistakenly notified by places that have done tests. And there's been a lot of talk about that, and a lot of people are concerned. And that's...
Well, I mean, there's going to be mistakes anytime, something happens, writing down the wrong name or clicking on the wrong person in the computer. I mean, that does happen.
I'd like to interject in here too. This is of interest of Homeland Security now. So if anybody out there has this situation and they have the actual letter, please contact myself here at Scioto EMA, because this is not just our community saying this. This is like a widespread rumor all over the United States. And they're trying to run it to ground. So they really like to get their hands on one of these supposed letters that people have gotten, so that they can really dig into it and investigate this.
I will kick in. Although I'm not a health expert, I am something of an expert in tech scams. And it's the same thing. Some places will... oh, you tested positive, just like it says your account's been hacked, on the off chance that you'll respond and give them your social security number or send them some money or something like that. And I'm going to move on to, that's just my 2 cents. I'm going to move on to Mr. McKibben.
Thank you. Here's a question for either doctor. Has the U.S. Centers for Disease Control and Prevention or the National Institute of Health issued a timeline recently on when a vaccine will be on the market for individuals to be vaccinated? The companion question: once the vaccine is generally available, like the influenza vaccine we now have, in your opinion, will Americans have to take a coronavirus immunization each year, or perhaps even more often? Who's the doctor?
That's a tough question to answer, Sam, because we don't have really don't have the data. We don't know when it's going to be available. We're hopeful it's going to be available in the next six months or so, or maybe even less so. But and we don't know how effective it's going to be. Is it going to be a vaccine like the measles vaccine and be highly effective? Or is it going to be like the flu vaccine and be 30, 40, 50% effective, depending on the year or whatever. So that is still out there. I don't know if David has a comment or.
Well, I mean, what you said is very much the bottom line, but I would just add that, the studies that have been done so far in people that have had the disease have shown that some develop antibodies protection, but some do not who get the disease. But more importantly, those that get antibodies, those numbers, that the level of antibody has seemed to go down with time. And so what we don't know, but only time will tell us, is that if the vaccines that become available provide adequate immunity, which is the first part of that, right? Are they effective? And the base for the CDC or the FDA approving these will be about 50% effective or more. But the other part of that is how long does that last? And unfortunately, because we are trying to roll out a vaccine very quickly, safely, but very quickly, it is quite likely that by the time the vaccine comes to market, we will have data on its efficacy and its safety, meaning how likely it is to prevent from COVID disease and how safe it is for the most part. But I'm not sure we're going to have any good data initially on how long that immunity lasts. And I suspect that'll be one of those follow-on where we all get the vaccination and then we figure out with follow-on studies whether or not we have to be boosted.
Very good. Thank you very much.
Concerns again in the comments. People really think that there's going to be some sort of mandatory vaccination for everyone, and a lot of them aren't happy with that. Does that seem likely to anyone?
Well, we're Americans. We don't like to do things the government tells us to. That's the first thing we think about. But I think it depends on the efficacy and the safety and all that too. I think a lot of people will take it just because they know they're at high risk. I've already have patients asking for it when they can get it. So if you have a lot of comorbidities, a lot of medical problems, you'll be more likely to get it. But we'll have to see how effective and safe it is.
Are there vaccinations for any other type of coronavirus?
I don't think so.
I just wasn't sure. I know there are lots of other kinds of coronavirus, but I wasn't sure if there were any other vaccines.
I'd like to say vaccines are very safe. There's only been one vaccine that was pulled off the market. That was an RSV vaccine. But vaccines are incredibly safe, and they've saved more lives than any antibiotic that I or Dr. Byers or any other doctor has written. We don't have smallpox today. We don't have polio. I mean, vaccines are wonderful.
Yes, they will go down with indoor plumbing and the fire or electricity as the things that have moved humanity forward the most.
All right. Since I interjected there and asked, I'm going to move on to Mr. Malliott. Am I butchering his name?
Okay, you said it wrong.
Oh gosh.
Three different ways. It's all right.
I'm terrible.
Like buffet Malay. So, or call me Malin. Just don't call me Joe. I don't know.
Chip.
But
I wanted Chip.
the question some people have been tossed along for me to ask is, one, do you think that COVID was here earlier, such as in January, February, before it hit, that we knew of it? And do you think you can get it twice if you've had COVID?
Yeah, if you're talking about here in Scioto County, I don't think it was here in Scioto County in January or February. It may have been in the United States on the West Coast at that time, but not necessarily here in Scioto County. There's a lot of bad viruses out there that make you feel really sick. Again, we tested people in March. 20% of these people had something on our viral panel. And you say, yeah, you've got metapneumovirus, you've got rhinovirus, you've got the adenovirus. That's why you're so sick. Now go home and be sick. So, that, and I guess to piggyback on that, we've also had over 200 people get tested for the antibodies. Again, it's only 2% are positive for it. So, I don't think we've had a large spread here in Scioto County.
Okay. Again, do you think, maybe this is still yet to be seen because we're still making a sausage here, but do you think if you've had COVID, what are the likelihoods of getting it twice?
David, you want that one or?
Sure. I mean, again, and the answer to that is get back to the sausage question, but the CDC put out a statement last week where they updated on the consumer page where they felt that if you had COVID-19 that you likely could not be reinfected for 3 months. And again, that's the key words being likely, and the 3 months number is somewhat arbitrary. And the thought is that most of the data we've got on antibodies has shown that people had reasonably high levels, at least for that period of time. But what we don't know is whether or not, even if they had those antibodies, if it truly prevents you from being infected. And I guess, as Dr. Martin mentioned before, the best analogy we can come up with when we talk about can you get a disease again or how effective vaccines are is we come back to measles and influenza. So if you get measles, you almost never can get it again because the antibodies you create for it are so effective. Influenza, there was a very elegant paper done just last year that demonstrated that in a small group of people that they followed, they actually demonstrated that they got influenza twice in the same year, the same strain, right? And so the issue is that we don't know yet if you can't get it again. We think in the short term, you probably can't or are less likely, or if you get it again, you might be less sick than you would have been the first time, but we just don't know the answer to that yet.
Okay.
Thank you, Chip.
Just call me Chip. That'll work.
Yeah. The other thing I would like to follow up with. Okay, completely lost my train of thought. So I'll move on to this question from a reader, and I think I know the answer to this, but they asked regarding the health alert statuses from the state. How can we go from orange to red back to orange in one day when we have more cases?
Yeah, I'd like to point out that that's run by the state of Ohio, so I don't have any input to it. But what happened was, I think it was the rapid increase in cases, and then we got a leveling off, and then it's kind of dropped down. So that was the rate of change that kind of got us to red, and then we went back to a more of a level number, and that got us back to orange.
Okay. Anyone else want to jump in there on that, or is it what did you say?
Yeah.
And there's the 7 indicators, and it's simple math. If you get 4, you go up, and if you get rid of all the indicators and don't meet them, then you go down. But and we've tried to push that out to everybody because it was sort of like a mystery, but they do base it on the new cases per capita, also ICU beds, how many ED visits there are, also the outpatient rate, some of those other indicators. So this past week we only met 2 out of 7. The week before we met 3 out of 7. So we were real close there last week. If we had gotten one more indicator, we would have been back to red. And if I could ask a question to the doctors here, I promise. Chuck Greenslate from WNXT, the sports guy, he's got a vested interest in this question, and he's wanting to know, and kind of dovetails into this. If we do go back to red, what happens to high school sports?
It's whatever the governor's orders is right now. It doesn't change based on the color. The attendance of school will change a little bit. Most of the schools have kind of ratcheted things up a little bit, that when we get to different color levels, you're going to be less likely to be in school. But as far as I know, that this governor's orders that just came out about school, about spectator sports and football and all that, and it includes indoor, so it may even go to basketball or volleyball later in the season. That won't change based on color.
Okay, I'm going to let you guys know. This thing's been flying by. We've only got just a little over 12 minutes left. So a little bit of a heads up there. And here. And I'm going to move on to, who did I talk to last? I can't remember. It's Mr. McKibben's turn.
Doctor, the state of Ohio and surrounding state safety guidelines during the coronavirus pandemic, what's your best assessment of the new normalcy, as they sometimes call it, the new normal for everyone when the virus numbers are considered low enough to resume from Star Trek life as we know it?
Yeah, and when is that going to occur? I mean, how many years is this going to go on before we're out walking without masks? And there's a lot of things that depend on that. The vaccines, medication. Could we eventually get like a Tamiflu for this? That's way down the road. But I think we're going to see us wearing masks for a long period of time, unfortunately. So this is, in a way, the new normal. I'm hoping to throw my mask away in 5 years.
Could be.
Yeah. Anything else, Sam? Yeah, okay. All right. Here's another reader question. Why is the public not notified when a worker at a business tests positive?
Right. What happens when someone tests positive is that the hospital has a positive test. They basically call or fax over that information to our department if they live in Scioto County, to David's department if they live in the city, and we call them up and we say, okay, who have you been around? What kind of contacts have you had with people? And a close contact is defined as being within 6 feet for 15 minutes or so. And then we contact those people and put them in quarantine and tell them to stay home and observe for symptoms unless they are essential workers. So I don't think the public, has to know. We're worried about stigma. We're worried about things like that. And I don't think businesses are allowed to share that information. But if you are significantly exposed and we know about it, you'll hear from us.
One thing I don't know if we have kind of gotten into, but I did hear some doctors address during one of DeWine's press conferences. It's the amount of time you spend exposed to the person too has a lot to do with it. They saying, being with someone for an hour is a lot different than being with someone for 5 minutes.
Yeah. We're looking at dosing of the particles, and when we talk and all that spit comes out, we're looking at dosing of the particles, how much of a dose you have to actually get infected. And that's why some people believe that you're wearing a mask yourself helps you not inhale all that, so you get a lower dose. They're looking at that a little bit. So wearing a mask can help others and can help you, we think.
Okay, thank you. Mr. Shope.
Yes, potentially in a long-term sense, how dangerous are positive cases reported in prisons and jails to the health of the non-incarcerated public?
Well, that really goes to community spread and how likely it is to get out of those, to get out and be circulating. Right now, if you look at Lucasville, mostly the guards have it, and they've had one positive, and that guy came from out of town and brought it with him. So it's spreading through the community and not necessarily within the jail. But it's just that concern of, the guards get it and they spread it out and give it to their families, and they spread it out and give it to everybody else.
Thank you.
All right. Good. All right. One of the concerns I have seen from several readers is that their line of work has required them to have multiple mandatory tests to come to work, and they're having to pay for these every time. And they were, again, kind of worried about how those are starting to rack up, or even just having to pay co-pays. I mean, if this goes on for a long time, people that are required with frequent testing could probably rack up some hefty bills for tests. Any thoughts on what could be done to alleviate that?
Is that one for LD? Because
anybody's got an idea. I mean, if you don't know,
they really
I
should.
will say that the big thing is that first off, the federal government, as part of the original CARES Act, had said that the insurances are supposed to cover coronavirus testing, and so if it's coronavirus testing only, there should not be a significant copay with that. But that kind of misses, I think, their point on a couple of the key issues there. One, if you are an employer and you're saying that someone that had the disease, you're going to make them get retested to come back to work, that is no longer the current guidelines based on the current CDC guidelines, but also based on what we know about the virus. And requiring your employee to be retested honestly only increases the chances that you won't get them back, even though they aren't infectious to others. So what we've learned about the virus is that test we put on the nose, that swab that we're doing in this community, is incredibly sensitive, and it can still be positive for weeks, but people aren't necessarily infectious to others. When we actually test that virus in the nose and see if it can replicate, if it can make copies of itself and make other people sick, what we've shown is in people that get not very sick, that they only have that virus there that's infectious to others for 7, 8, 9 days. And for people that get really, really sick, only for a couple of weeks. And so the CDC has put out guidelines that very much argue against having people continue to be retested, but rather say if they weren't very sick, when the health department lets them go out of quarantine at their 10 days, they can return to work. And as long as their symptoms are better, and if it's been 20 days or more and their symptoms are better, again, they wouldn't have to be retested to return to work. Because the thing to remember is that test is likely to still be positive, even though that employee is not infectious to others. It's going to drive cost, it's going to drive time, but we have to remember too that we can't overestimate or overstate this enough. Like, we as a community have to look at our use of masks, our creating groups where we all get together, our use of our testing. All these things have to be viewed at in terms of we really do have to take care and look out for each other. And when we're sending people in for a bunch of tests that aren't necessarily required, we're utilizing testing capacity that does have an upper limit, right? And so we want to make sure that we're good stewards of all the resources in our community. And so we're actually, I think there is a business leader roundtable on Friday that we're going to do a Zoom session with for some of the local businesses to really talk about coronavirus in the workplace. And hopefully we can try to answer some of those questions.
Okay, thank you. Mr. McKibben.
That's myself. My family and I have both the cloth mask and the paper face mask. In your opinion, doctors, are the cloth masks more effective in protecting someone, or does it make any difference?
David.
Sure. So what we do know is that if you are going to buy a medical grade surgical mask or an ear loop mask like this, its efficacy, its ability to work is basically guaranteed by virtue of the fact that it got FDA cleared kind of thing. And so we have a lot more data on the efficacy of our N95 masks that we use at the hospital, or these ear loop or surgical style masks. The cloth masks, unfortunately, we believe that some of them are, especially if they're tight fitting, are probably very good. They may not be they're certainly not as good as an N95, and they may not be quite as good as a surgical mask, but they are good enough, especially when we talk about decreasing your droplets to other folks. And that's back to the most important part of that is if we're all wearing a mask, whether it's cloth or it's a surgical mask, those are efficacious enough to prevent our droplets from infecting other people.
Okay. Thank you. Good answer.
Thank you. All right, we've got just under 4 minutes left, so I'm going to ask Mr. Mullins, Dr. Byers, and Dr. Martin, give me a sentence. Give me a closeout sentence. What do you want to say to people? What do they need to know?
Well, I think they need to know, wear a mask. It's a patriotic thing to do. I mean, it helps your fellow Americans from getting sick. It helps you from getting sick. Wash your hands and stay 6 feet away and be kind to each other.
Thank you. Anyone else?
Well, I think Dr. Martin said it best. I mean, we kind of pride ourselves, most people who are from this area, of helping your neighbor, and what better way to help your neighbor than help not get them sick? So please do everything you can to slow the spread.
And
One more left.
absolutely. And I would echo everything that has been said and just ask people to please help where they can, help others take this seriously as well. We are in the middle of a significant crisis, and this is taxing on all of our resources, nationally, in terms of healthcare, in terms of the economy, in terms of education, right? This is not lost on anybody. This has had a huge impact. But I would just ask everyone to be a good community member. Like everyone has already said, right? Look out for your neighbor, wear a mask, and be smart about gatherings.
Thank you. I want to thank Dr. Martin, Dr. Byers, Mr. Mullins for joining us, as well as our friends from print media and radio. I think we've had something informative here, and I hope we are able to help out a lot of people. And remember, anybody what still has questions, please keep them coming. That's we'll look into it for you. That's what your local media is here to do, and we'll try to do a little bit better than just what somebody posted on a meme in Facebook. Okay, now I'm finished early, so I'm going to work on pronouncing everybody's last names. And I was just going to add, we had 17 new cases today in Scioto County. Now we've surpassed 300 cases, and that's been 204 cases in the past month. So if that does kind of put it in perspective of where we're going, it's still a serious issue. And even if you disagree with people about things, let's all try to be kind. We were all kind to each other, and technically we're all competitors. So you can pick that up and try that too. And also, if you have any more questions, you can get in contact with the health departments and the EMA, and they will point you in the right directions as to where to get answers.
Well said.
Yeah.
Thank you.
I'm a professional, even though I can't pronounce anyone's name.
Very educational. Thank you.
Yeah, thank you. I'm just waiting for to roll credits.
What's cool is I know everybody in here. So
It's like I feel like we're on the Brady Bunch. If I was in TV, we'd be doing stretch.
Well, it is like building an airplane while you're trying to fly it. So
Have a great weekend, everybody.
Thank you guys for participating, and I do have a mask. We should have all worn masks and shown we were. Yeah.
I'd like to give one shout out to my buddy Larry Dale Mullins. He's been very helpful with me and getting information to the radio, writing my news for me. So thanks, Larry.
He's good. I'm in my home office.
The same here. Thank you very much, Larry.
Thank you, guys.
Good job.